Hello, I'm Dr. Toral Vaidya. Welcome to my YouTube page. I want to kick off my page by talking about something that people ask me about all the time, and that is anti-aging. So let's talk about what actually works for anti-aging in terms of skincare, in terms of diet, as well as other cosmetic procedures. I want to preface this video by saying I do not like the term anti-aging, but it is what the skincare and beauty industry uses. I feel like the term anti-aging sort of sounds like we want to stop aging in its tracks. And the truth is, no matter what you do, this is just not possible. I like to think about anti-aging more as graceful aging. So all of us are going to age, our skin is going to age, but what can we do to sort of slow down this process? And what can we do to optimize our skin in the stage of life that we're in? So that's kind of my thought process, how I deal with my skin, how I counsel my patients, my family and friends. So that's kind of how we're going to talk about skin aging throughout this video. So when most of us think about aging of the skin, we probably think about more wrinkles and fine lines, but we should really understand why this happens in the skin. And essentially, this is because of collagen breakdown. Collagen is probably one of the most important things for our skin in terms of giving it its firmness, elasticity, and its structure. And over time, collagen naturally breaks down in our skin. We start losing collagen in our 20s, and we start losing about 1% a year as time goes on. Other things that contribute to skin aging and that collagen break down faster include lifestyle habits such as drinking or smoking. Skin aging can also look like an uneven skin tone. So this can look like brown and dark brown patches on the skin. This is usually associated with sun damage. And the last thing with skin aging is that sometimes you can have loss of sort of that tissue below the skin, and this is very natural over time. And the tissue is mainly fat, and we lose some fat in certain areas of our face that can contribute to a more sagged appearance. Over time, we also lose a little bit of our bone structure, and this can kind of contribute to that sagging appearance. So let's talk about skincare that actually works in terms of anti-aging. And to me, 4 main things come to mind. Number 1 is sunscreen, number 2 is retinoids, number 3 is antioxidants, and number 4 is peptides. So number 1, sunscreen. I'm a dermatologist and I tell pretty much every one of my patients that they should wear sunscreen, not only to prevent skin cancer, but also to slow down skin aging. The sun is a major driver of collagen breakdown in our skin. It's important to choose a sunscreen that's SPF 30 or above and specifically labeled as broad spectrum. And broad spectrum means that it covers both UVA and UVB. UVA leads to skin aging, UVB leads to sunburns, and both can lead to skin cancer. I can't stress enough how important it is to wear sunscreen to prevent accelerated skin aging. Number 2, let's talk about retinoids. Retinoids to me are the holy grail skincare ingredient in terms of anti-aging. The way that retinoids work is that they essentially are vitamin A derivatives that work by turning over our skin cells at a faster rate. And in this process, it essentially boosts collagen in our skin. Retinoids do have so many benefits for our skin in terms of treating acne, preventing acne, regulating oil production, evening out dark marks, but most importantly, boosting collagen, which is very important for anti-aging. There are many different types of retinoids on the markets. There's over-the-counter as well as prescription. Over-the-counter retinoids that I like for an anti-aging purpose include retinol as well as retinaldehyde. So next, let's move on to antioxidants. So you probably have heard the word antioxidant thrown around a lot, but what does it actually mean? So antioxidants essentially work by targeting the free radicals that are released in the environment by the sun or by pollution. And this is important because free radicals have been shown to contribute to skin aging. So by using an antioxidant, you're essentially targeting those free radicals and preventing that process. Now, an antioxidant that I love is vitamin C. Vitamin C is a very commonly used skincare ingredient, and there's lots of different types on the market, but I personally like L-ascorbic acid, and that is the pure form of vitamin C. The downside to L-ascorbic acid is that it's a highly unstable compound, so you want to make sure you buy a product that's well formulated. It also helps if it's formulated with vitamin E or ferulic acid. These are also antioxidants, but they also help stabilize vitamin C. I think 10 to 15% is a great place to start. The last thing I want to talk about in terms of anti-aging is peptides. So peptides are essentially little building blocks for proteins, and there are many different peptides in skincare, but some of them have been shown to help boost collagen. I really like peptides for those who have sensitive skin who might not be able to tolerate a retinoid. I also like that peptides can be used with other skincare ingredients without causing excess skin irritation. So those are the 4 skincare ingredients that I actually think work. How do you incorporate them into your skincare routine? So this is my skincare routine specifically. So I wake up, I wash my face with a gentle cleanser. I then use an antioxidant serum like a vitamin C that we talked about. Then I use a moisturizer if my skin is feeling dry. And last, I use an SPF 30 or above broad spectrum sunscreen. At night, I will cleanse my face and then I'll use a retinoid, either an over-the-counter or prescription one, and then I'll layer it with a moisturizer. Sometimes I also incorporate a moisturizer with peptides. I hope this video helped you, and let me know if you have any questions.